Hello friends, let's revise microbiology quickly. So we are seeing this condition. This is Sporo Trichosis. Sporo Trichosis. Here it is the along lymphatics. There is necrosis and ulceration. This is produced by Sporo Trichosis, which is dimorphic fungi. This disease is also known as rose gardener's disease because of this infection gets due to rose thorn pick. This is this produces cigar-shaped asteroid bodies. Cigar-shaped asteroid bodies. So in the diagnosis, we this is the finding cigar-shaped asteroid bodies, and also we can use latex agglutination test for diagnosis too. Okay, again, so Sporothrix shankai produces this disease. Sporotrichosis has three forms. It has three forms: cutaneous forms, lymphocutaneous forms, and disseminated forms. So cutaneous forms, to treat this condition, potassium iodide, oral or topical, can be used, and in lymphatic form, itraconazole can be used, and in disseminated forms, amphotericin B can be used. Amphotericin B can be used. Okay, so next point is the difference between exotoxin and endotoxin. So exotoxin, this is produced by gram positive as well as gram negative bacteria. Okay, so this is very highly toxic and it usually non-pyrogenic. It is highly antigenic, and this is polypeptides. Okay, what is endotoxin? This is usually produced by gram negative, except only one, which is listeria, which is gram positive and produces endotoxin. It is moderately toxic. So endotoxin is moderately toxic. It is pyrogenic and it is weakly antigenic, and lipopolysaccharides is the component of is the endotoxin. Okay, next one we see in this gram positive bacterial cell wall and gram negative bacterial cell wall. Gram positive bacterial cell wall has teichoic acids, and it also has sulfur containing amino acids attached here. Okay, and it has thick peptidoglycan. So this layer is thick peptidoglycan layer. And lipopolysaccharide, this is absent in gram positive bacterial cell wall. What about gram negative? Here we see peptidoglycan layer is thin, and teichoic acid is absent here, no teichoic acid, and it contains sulfur containing amino acid. So sulfur containing amino acid is present in gram negative bacterial cell wall, and the same is absent in gram positive. Lipopolysaccharide is present in gram negative cell wall. So we see lipopolysaccharide, and this is the cause antigenicity. Let's see some another points of here. Fungal cell wall. What about fungal cell wall? It is made up of chitin and menin along with polysaccharides. Mycobacteria, it has mycolic acid. What is the difference between antigenic shift and antigenic drift? So we see here S is more far away in alphabet than D. So there is too much separation in S shift. So this is abrupt and drastic discontinuation. So there is too much gap, and this is a sudden gap, we can say. So new virus that what is whatever is created is not related to previous strain. So previous strain is not related to new strain. So that's why previous antibody that's formed is not effective in antigenic shift new virus. Okay, what is antigenic drift? This is gradual one, and new virus is related to previous one, and that's why previously formed antibody still going will work. Next one is Staphylococcus and Micrococcus. The differentiating some factor. Micrococcus, it doesn't mean that it is smaller than Staphylococcus. No, this is the bigger. It is in a tetrad. Staphylococcus is in grape shaped cluster. Okay. OF oxidofermentation test. OF test is here in grapes it is fermentative, and in Micrococcus this is O. We can see big O, micro O. So this is this is big shaped than Staphylococcus. So I write here big O means oxidative. Now furazolidone test. This is a sensitive test in Staphylococcus, but this is resistant in Micrococcus. Bacitracin is resistant in grapes in Staphylococcus, and the same is sensitive in Micrococcus. Staphylococcus, this is actually facultative anaerobes, so it likes oxygen, and without oxygen too it can live, but Micrococcus, it requires oxygen. So here again big O indicate oxygen. Next one is the Kanagawa phenomenon. What is Kanagawa phenomenon? This is to differentiate between non-pathogenic and pathogenic strain of Vibrio parahemolytic. Vibrio parahemolyticus. Okay, so this bacteria. So what we are using Vagatsuma agar. What is this? Blood agar with 2% of salt. If there is hemolysis, complete hemolysis, this means heat stable hemolysin is present, and this strain will cause disease. Vibrio parahemolyticus, such a strain which is hemolytic in nature, is pathogenic strain. Okay, and without hemolysis, such a strain is non-pathogenic. What is bacteria toxin? Next one. This bacteria toxin that inhibit protein synthesis को inhibit करने वाला. So we have EF2 factor inhibitor. So this is EF2, this is elongation factor. So two bacteria, diphtheria and Pseudomonas, their toxin is going to inhibit EF2, so elongation factor is inhibited. What is the mechanism? ADP ribosylation of EF2. ADP ribosylation of EF2 will cause stopping of elongation factor. Okay, so diphtheria toxin and Pseudomonas toxin, both these are working mode is very similar. Now what about the enterohemorrhagic E. coli, EHEC? This toxin is almost same like Shiga-like toxin. That's inhibition of 60S. Next, what is Prosnitz-Kushner reaction? This shows the presence and activity of IgE. So we take serum from allergic person and introduce to that serum non-allergic person, and then we introduce antigen. If there is will If skin is showing veil, it means there this person is sensitive to that particular antigen, because here is the serum transferring from one patient to another, so there is increased risk of hepatitis and AIDS. So such test is obsolete right now. अब यह नहीं किया जाता है. Okay, what is this? This photo is showing, this picture showing aspergillus. So what are the some specific feature of aspergillus? It has branching at acute angle. Branching is on acute angle. It has septate hypha, so septation is seen. It is dichotomous. Dichotomous means equal growing points, branching points means right and left. So on same point there is a branching. Okay, so this is aspergillus species. Okay, next one is Cryptococcus. All these photo is this slide showing different photo of Cryptococcus. When you cry, the mnemonics, when you cry, there is a just like drop like, okay, this drop like. So Cryptococcus is a unicellular yeast. Now next one, ascospore is what? This is sexual spore of Ascomycetes. What is this? Next one, this is swarming growth in agar plate. It can be shown by gram positive and gram negative bacteria. The example of gram positive that shows is Clostridium tetani, Bacillus cereus. Example of gram negative that shows swarming growth is Proteus mirabilis, Proteus vulgaris, Vibrio parahemolyticus. Next, this slide shows Brugia malai. I wrote here A and A. 2 small a is showing the two terminal nuclei is present. Here in Brugia malai. Vauchereria bancrofti, it has big O means 0, means nothing, so tail has no terminal nuclei. What is hepatitis A virus? So what about this one? Fecal oral route, we know this. Okay, it is non-enveloped virus. It is RNA virus, belong to Picorna family, and the formalin inactivated vaccine is available for the same. Formalin inactivated vaccine is available for hepatitis A. Next and last point of this small lesson is IL-2. This is produced secreted by T lymphocyte. Okay, so thank you friends, like and subscribe my channel.